Hi, my name's Dr. Ross Hauser. Thank you for watching, filming here from beautiful Southwest Florida, Fort Myers, Florida, where Caring Medical is located. A common symptom that we see in our patient population is nausea. And anybody who's been nauseated, and let's be honest, we've all been nauseated, it is like awful. There was a time period where I was nauseated for several months. I lost a bunch of weight, and I actually thought I had pancreas cancer, if I'm honest. And there was a day where there was 20 patients scheduled. After the first patient, I threw up bile in the bathroom, and I told Marion I actually can't see anybody else. I mean, it had been going on for months. Long story short, I went to the emergency room, had an endoscopy, and they found out that I had giardia. You know, so I was fortunate in that I had a very treatable cause of chronic nausea, and they found it. But there are so many people that have nausea for days, for weeks, for years, that nobody can figure it out. And you guys know I often say that you got to follow the neurology when you have a symptom. So I'm just going to talk about some of the neurology of nausea. And we all know that if this is the skull, this is the carotid sheath, and this is the cervical curve, you're supposed to have a normal lordotic cervical curve. That's what this would represent. Once you have ligament laxity, so ligament laxity occurs with all of us when we look down, and now we're looking at our cell phone, and the vertebrae separate, and then you have a change in the cervical curve. See how the cervical curve is changed? And what happens with that change is it can compress. This represents the carotid sheath, once you get a compression of the carotid sheath, it's going to start affecting the vagus nerve. Some of the signals of the vagus nerve are going to be blocked. Once you start blocking the signals in the vagus nerve, the stomach stops working. And when food just sits in the stomach, basically you're going to get nauseated. You're going to get bloated and nauseated. When the vagus nerve doesn't have input, you have decreased stomach acid. That can give nausea. Cervical vagopathy can cause leaky gut syndrome because the vagus nerve, each vagus neuron connects with about 1 to 5,000 neurons in the enteric nervous system. There's hundreds of millions of enteric neurons. So every time you knock out a vagus neuron, you're basically knocking out up to 5,000 enteric neurons. And it's that nerve input into the digestive tract that keeps the tight junctions between the columnar cells together. Once you have an injury in the nervous system and the nerve impulses aren't going there, these tight junctions separate. Then all of a sudden, when you're eating food and it's getting to that place, the food particles and substances will get absorbed that really shouldn't be absorbed. So this is a really important concept. The contents in your digestive tract that are in your stomach, in your small intestine, they are technically not inside your body. Like, they're not involved in the immune system. They're not in the blood. So in other words, this barrier, like the blood-brain barrier, is supposed to keep certain substances out of the body. What's supposed to translocate across the tight junctions in the digestive tract is simple sugars, simple amino acids, simple fats, simple fatty acids. Once you have leaky gut, in other words, the columnar epithelium aren't tight together, and all of a sudden stuff can translocate across that, then the body mounts an immune system against that. So basically, the easiest way you can get sick or get an autoimmune disease is through the digestive tract, right? How is something bad going to get into your body? It's going to get into there either through your lungs, right? With the current COVID situation or flu season, this or that, it gets in there through the lungs. Or the food that you eat the body's not discriminatory as it should to keep stuff out and let good stuff in. So basically, when you have cervical vagopathy, bad stuff gets in, and some of the bad stuff can give you nausea. Now we see here your brainstem. So what that means is when your curve changes, you can get kinking of your brainstem. The bottom of the brainstem, which is right by the C1, C2 level, is the medulla. That's the lowest part of the brainstem, and that's where your nausea center is. So just having upper cervical instability can cause the nausea center in your brainstem to get activated, and that can give you like horrible, horrible nausea. When the carotid sheath gets kinked, right, and normally the carotid sheath gets kinked, like when you have forward head posture, this is kind of, see how it's really relaxed here, the carotid sheath? Then when you have a forward head posture, see how it has to go around here, it gets kinked right at C1? Well, that decreases the brain's ability to drain because the internal jugular vein is in the carotid sheath, and that causes increased intracranial pressure or pseudotumor cerebri. One of the main symptoms when the pressure inside your brain is too high, you get nausea. So that's a very well established symptom of pseudotumor cerebri or increased intracranial pressure. We measure that in the office by optic nerve sheath diameter. When it's over 5, 5.5, that means that a person's pressure inside that side of the brain is over 25 millimeters of pressure. And we find this in a lot of people who have cervical instability. We all know that you don't feel good, like one of your ears is plugged. You know, most of us have had this. You just don't, like your balance is off. Now, when your ear is plugged because of eustachian tube dysfunction, and the eustachian tube is what opens and closes to regulate the pressure between the right ear and the left ear. And when the pressure gradient is different, you feel off like you're seasick, right? One of the symptoms of being seasick is nausea. I could tell you stories about different times I've been seasick on the high seas, but I told you about the Giardia. Yeah, that's probably enough for one YouTube video, but the eustachian tube dysfunction is caused by cervical instability because it affects the nerves that go to the muscles that open and close the eustachian tube. You kind of know this is your cause of nausea because you'll normally have one-sided symptoms such as fullness in the one ear, ringing in the ear. So that's a clue that your nausea is from eustachian tube dysfunction. Dysautonomia is a condition where the autonomic nervous system isn't working correctly. There's an imbalance between the parasympathetic or the vagus nerve and the sympathetic system run by the sympathetic ganglion in the neck. So in the front of the neck, the ganglion of the vagus nerve sits right in front of C1. The sympathetic ganglion, there's 3 or 4 sympathetic ganglion. The top one sits in front of C2. The middle one sits like at C5, and then the stellate ganglion, the lower one is at C6, C7 down at the bottom. Then when you have cervical instability, there's different reflexes. There's oculocervical reflexes that balance your eyes in relationship to your neck. When you have cervical instability, it means that there's ligament damage in the neck, and many of the proprioceptors, or the signal receptors that tell the brain where your neck is and your head is in 3D space, are in those ligaments. They're in the joints, they're in the ligaments. And when you have ligament damage, your 3D perception of where your head is and where your neck is in 3D space goes down. And anybody who's been dizzy, something's off, knows that you can absolutely get nausea. If you have unexplained nausea, I'd really recommend that you have us assess you for cervical instability. And the method that we use is digital motion x-ray. And if we find that, and you've had your neck structure is broken, and we call broken neck structure cervical disc structure, then we do a modality called cervical curve correction and dynamic orthoneurologic correction, or chiropractic adjustments, to get the anatomy good, the curve optimal, and then we do prolotherapy to stabilize the neck. And we find that that treatment method is very effective for people with chronic nausea.